So now we're going to the next vein, which we get to discuss its anatomy, and this is what is known as the great saphenous vein. The great saphenous vein. All right. So this image, yeah, I actually prefer this image. It will give a very, good outlook to where this vein is found in the body. So the great saphenous vein, if you look at your leg, inside your leg, near your knee, a vein runs there, a very big vein that for people that are lekba, like you are not really fat, if you palpate, you can even feel the great saphenous vein there. It's the biggest vein in the leg. So that is the biggest vein in the lower limb. Okay, great saphenous vein. Great saphenous vein. So the great saphenous vein, you should know that is the longest vein in the body. It's the biggest vein in the lower limb too. Alright, so it's the superficial vein of the lower limb, and it runs along the medial side of the leg. When they say medial, it's just inward. Okay, something that is outside is what? Lateral. So it begins at the foot and it ends by draining into the femoral vein at the groin. That's if you are going up like this, right? Can you see how the great saphenous vein came and inserts here? That becomes the femoral vein. I don't know if you understand. So that's it. So it begins at the medial side of the dorsal venous arch of the foot, receive tributaries from the medial marginal vein of the foot. So it ascends anterior to the medial malleolus. It runs along the medial side of the leg and the thigh, passes posterior to the medial condyle of the femur. So continues upward in the subcutaneous tissues and terminates by piercing the fascia lata at the saphenous, opening the groin. Okay, then it now becomes the femoral vein. So tributaries, a lot of tributaries from the leg and thigh communicate with deep veins via perforating veins, receive the superficial epigastric and the superficial circumflex iliac and the superficial external pudendal veins. So drainage, it drains blood from the superficial tissues of the medial foot, the leg and the thigh, connects to the deep venous system. Okay, so clinical significance, right? We learn about the anatomy of this vein because this vein can be involved in what? Varicosis. Varicosis is like, can you see how this vein is straight down? The vein can now later come and, how will I put this in a layman's knowledge or language? Like, in medicine they say it's become tortuous. Okay, like it's kind of like almost be folding up. It will no longer be straight and smooth like that. Okay, that's a disease condition. Okay, you can also use this vein, okay, where you are doing all those bypass graft, that's coronary artery bypass graft. We'll talk about it later. Then venous access too. If I want to now access any vein in your lower limb and maybe give you drug or do blood transfusion, that's if veins on your upper limb, that's veins on your hand, they are having issues, I can access the great saphenous vein. So it's an alternative. You understand? Then drainage, you said that I've spoken about all of this. The landmark, okay, so if you know where this vein starts from, where it ends, it will now give you a better knowledge of the anatomy of that area. So that's what we have for the great saphenous vein.